Despite all the success in scientific and public health industry in the 19th century, society found it difficult to adjust to the need to control family size. This imbalance has generated an explosion in global population that is difficult to accommodate, has contributed to greater inequalities in wealth and untold personal misery. Today, the patriarchal outlook and contraceptive norms in the society have a bigger role to play in family planning than we are led to believe. Till date, according to most studies and cases in India and around the world, birth control, whether temporary or permanent, is looked at as a woman's sole responsibility. In most of Indian households, reproductive health and family planning are topics which aren't discussed upon. Most national awareness campaigns are women-centric, which leads to these women taking the burden and responsibility entirely when it comes to birth control. Biomedical scientists for the past few decades have been working on what they call their holy grail, the male contraceptive pill, which may have side effects though may be milder in nature. Latest research developments suggest that men might be able to take their pick of preventive products very soon in 2021, ranging from gels, daily pills, monthly injections, and even a reversible chemical vasectomy. A balance between genders when it comes to reproductive health can be achieved with the emergence of these products. But the question that emerges will be whether these products, while being extremely beneficial for the society, be accepted in the Indian markets efficiently and willingly. Bureau Report, Democracy News Live, New Delhi.
Good evening, I'm Rohit Gandhi and you're watching Democracy News Live. Welcome to our show, It Matters. We are here to discuss today the norms prevalent in our society when it comes to reproductive health, family planning, contraception methods, and how these will play a part in the emergence of the male contraception industry. Women for years have taken the burden when it comes to birth control and family planning. The patriarchal outlook of society has made contraception, whether temporary or permanent, a woman-centric process. The rules, the decisions, and permissions of which are governed by the society and their male counterparts. These contraception methods produce side effects and affect the ovulation process in a woman. Globally, 70% of the contraception users use female contraception methods. Female tubal ligation takes up 23.7%, the highest among all methods. And in contrast, only 2% undergo vasectomy, despite it being a simpler process with milder side effects. When it comes to looking at, tubal ligation, in India, the percentage of vasectomies is at 0.3% of all users using contraception methods due to improper sex education and a patriarchal, outlook towards life. Traditional and orthodox families have not made the change towards better ways. A balance between the genders in terms of responsibility for reproductive health and family planning is to be achieved, for which proper awareness is required. And I think that's what we'll be discussing today. Despite witnessing, massive changes around, and strides in science around all of this, it's still stuck to the old social setup. And we are here to discuss this with our guests today. We have a very, very eminent panel today. We have Dr. Ruchi Tandon. She's a consultant gynecologist and a laparoscopic surgeon. We also have with us Dr. Jyotsna Gupta. She's a senior consultant in the Department of Gynecology and Obstetrics. And we have Dr. Nauzer Shahryar. He's a consultant gynecologist and an obstetrician. He was also the ex-Secretary General of the FOGSI. Welcome to the show, all of you. Let me start with you, Dr. Shahryar. Explain to me, why is it such a difficult task for expecting men to, take on the burden of, female of contraception?
So, Rohit, thank you. This is a topic that really needs to be brought into limelight and talked about. But interestingly, let me put things in context. 70 years ago, a majority of contraception was male contraception. Vasectomies were the norm, not tubectomies. Condom was probably the only real contraceptive available besides the diaphragm. And then something changed. Technology changed. And suddenly we had this large number of options for women, and we had limited options for men, which was a very convenient thing for society because it immediately shifts the burden of this responsibility to women. Uh, there were many factors. When sterilizations happened, laparoscopy for patient, men decided to suddenly step aside and women decided to take that leading role. Societal burden always remained, and it's not always just men, but it's society as a whole. And I can tell you from my practice, and I'm sure my colleagues will also bear me out, that very often sitting there with a couple, counseling them about contraception, telling them how easy vasectomy is and how safe it is, the man very often will be non-committal, and then finally the woman will step up to the plate and say, you know what, I will do it, because the consequences of pregnancy and unwanted pregnancy are unequal and they fall squarely on the woman. So I think this has to change, and the change will come when technology catches up. And there is the biology in men which is different from women, which makes these technological advances difficult, though not impossible. And maybe we can speak about them
Sure.
as
Sure.
our panel discussion
Sure.
progresses.
Sure. And you bring up a very important point, that it's not as if it's not discussed, as if it's not as if the knowledge doesn't exist. And this is, I'm talking even about the educated bit. But when the man and the woman come to the doctor and they sit down and they realize it can actually be done with really mild, and it's far easier on men, but they decide still not to take the journey. And the woman steps up to the plate. And this, like you said, it's only in the last 70 years that this technology has become available, and how the burden is shifted. Dr. Tandon, let me bring you in here. Explain to me, what is missing in this knowledge awareness base that needs to be re-emphasized for men to realize that the responsibility also lies equally with them, and how is this going to be decided? Because it shouldn't be that the whole burden shifts back again to the man if it was only his responsibility 70 years ago. How does one reach a conclusion? What is the best way forward? Because it needs to be a balance, right?
Yes. Hi, Mr. Rohit. If one compares the risks and benefit of any contraceptive, it is observed that more deaths occur as a result of unplanned pregnancies than from the hazards of any contraceptive method itself. Acceptability is the most critical factor in the effectiveness of any contraceptive method. Now, as Dr. Sherian has rightly said, that the burden does fall on the couple, and in most cases it is seen it falls on the women. From the technical point of view, I would like to emphasize that tubectomy, which is being done even in government setups, is a more effective way and rather a more permanent way. But of course, the disadvantage of tubectomy is its reversibility, as is the same case with vasectomy. The question that comes into play is how is it possible to reverse the effects of this? And various techniques are being developed, including what we are going to be talking today, that is the male contraceptive pill. The biggest advantage of the male contraceptive pill is its reversibility and the fact that it has to be taken in a single dose every day by a man. It is not a surgical technique, and it can be taken by healthy couples, and it has very few side effects that have been seen so far. It has already cleared the first phase of the trial, and I really hope when it enters the market, which should be soon enough, it is accepted and made freely available, rather than the burden of contraception falling on the female partner.
Sure. And, Dr. Tandon, the reality is, when it comes down to childbirth, when it comes down to looking after the child, bearing the child, all of that burden actually lies with the woman already. So, as I started out by saying, it shouldn't shift to the man, but, at the end of your answer, I would say, if the man takes on that burden, it's not a big burden, because the woman already has a lot of the burden of that whole companionship, of taking on what she needs to take on. So I don't think it's such a big burden at the end of the day. Dr. Gupta, let me bring you in here. It's when you look at the idea of a male contraceptive pill, does that seem like a viable idea? And honestly, I want to go even beyond just the male contraceptive pill. Are there other methods which can be deployed and should be used? And overall, how accepting will the society be around him?
Hello, Mr. Rohit. As my both the colleagues have already said a lot about the male and female pills, contraceptive, and everything, I would like to say here that male contraceptive pill, even if it comes in the market, it will be very difficult in India to be exactly to be accepted by the male partners, because there are few drawbacks with the male contraceptive pill, because it may take few months or few days for it to be more effective, and its effect may last for a few times, maybe 1 2 months or 3 months. So its effect has also been seen as a difficult and variant in all the partners, all in the male, as in the shown in the studies. So in India, I think male contraceptive pill acceptability will be very less. Even as seen in vasectomy also, the male partner doesn't accept the vasectomy very well. Even if it is the tubectomy complications are more in female partner, even then they are not willing to undergo vasectomy in India, because their mindset is that it is the vasectomy may cause impotency, it may hamper their sexual desire. These are the certain myths which are to be dealt with the vasectomy, or with and with anyway in the with the male contraceptive pill also. So these are the basic things, because till the time the mindset of the Indian men doesn't change, these methods will not come into play as desired by any government or by any pharmacy or any doctor who wishes to be in this study at all.
Sure.
Because main thing is the mindset of Indian man. They
Sure.
don't want to do that. Even the it is easily available, it has less complication, it has doesn't have any effect on their health, and even though there is no stitch comes on the male partner, even then.
Right. No, and absolutely. In the 1970s, obviously, one of India's, the Prime Minister's son literally went out on a rampage to try and get vasectomy into villages, and but there was a massive amount of pushback. Obviously, the process and the way they were carrying out was the wrong process. It shouldn't have never been forced. There should have been awareness and education. But again, the macho mindset certainly gave that pushback, and India has not been able to implement it. If you see the level, it's 0.3% of all contraception is
Yes.
is vasectomy, which is very, very, very little. Dr. Shariar, male, a patriarchal mindset certainly continues to create that challenge. Where do you think will we find the solutions? You were talked about, newer methods and newer technology. Explain to me when you say that, what do you mean?
So Rohit, we've been on the lookout for that male contraceptive pill for a very long time now. And just in a line to tell you, the difficulty of this was that in a woman, the process of ovulation and menstruation, which is preparation for a pregnancy, is a monthly process. For a male, it's a continuous process. So medications given to women can be extremely effective, 99.9% effective in men. The process will not be equal in all men. As was rightly said by my co-panelist, it may take months to take effect. And there is no doubt that it will bring down hormone levels. And in men, libido is governed by testosterone, and most of these do work by reducing testosterone. But we have to keep pushing and being on the lookout for the right method, because at the end of it, if there is a choice, people will accept it. Now, when we are talking about these male methods, others have been tried. Intravasal devices have been tried, like the intrauterine device. I think the greatest advance was what we call as the non-scalpel vasectomy, which kind of made the whole process so much simpler. Where do we go from here? Well, firstly, I believe there has to be a structured counseling choice. I have realized that everything will find its niche if it's available. There has to be a committed provider. I know some very successful vasectomy programs in the Family Planning Association where, when handled right, a large number of men did step up for vasectomies. There has to be involvement of the male, no matter what, in a very sensitive way, or Leave the male out if the woman wants to leave him out. Today, there are some great female contraceptives which don't need anyone's permission, which can be done quietly without anyone knowing. And at the end of it, Rohit, you said it so beautifully. Sex education, every young person should start off life empowered with the knowledge that pregnancies can be prevented, pregnancy should be prevented, infectious diseases can be prevented, should be prevented. And at the end of the day, if you can't prevent it, then please be aware that safe abortion is available for all those patients where contraceptives let them down.
So what you're saying is the reality is, and so I think it brings us back to square one with what Dr. Ruchi was talking about. The pill in itself has its challenges about bringing testosterone down and bringing libido down, which is certainly one of the things that a lot of male, men have, pushed back towards anything, to do with contraception. But vasectomy, like you said, does not do that. It doesn't impact the libido. It doesn't impact, any other processes in the male body. So possibly that's a good way. Education is a great way around that. But at the same time, women deciding to protect themselves, because at the end of the day, contraception impacts women more than it impacts men physically. Apart from the way the structures are built, that's another story. But physically, a woman gets impacted, so she must, at some level, still continue to hold the control on her body and decide how she's going to run or how she's going to interact with a man. I think it's a very, very important point, Dr. Sharia, that you made. Dr. Tandon, let me come to you now. I know from your perspective, the pill possibly is a good way forward, but explain to me when Dr. Sharia and Dr. Gupta talk about it in terms of how that actually can bring down libido, and if it's true and if that's what the study is, then explain to me what is the way around it.
Hi, Rohit. As has already been said by Dr. Sherian, the pill acts by at the level of the androgens, and it acts as a synthetic progesterone derivative. So what it is basically doing is it is reducing the male hormone, that is the testosterone, and replacing it with a synthetic testosterone. I wouldn't say it completely brings down the libido, but definitely there are side effects of using the pill as well. But definitely it is much more easily accepted since it is a non-surgical technique. And the biggest disadvantage, or rather a challenge that it would still rather have to face, is that the sperm is produced in a matter of 90 days, 60 to 90 days. So its efficacy is actually proved in that period, in 60 to 90 days. In the female pills, ovulation inhibition is rather easier. It takes about 15 days to inhibit the ovulation, and efficacy is 99% if it is taken properly and cyclically by the female. So of course it does have its challenges, but it is definitely a non-surgical technique, and if it is introduced into the market, I don't see a reason why it cannot be introduced as another means of contraception. And for a male, it is a better choice rather than a surgery. Since we already know, and since you have already highlighted that vasectomy was not very well accepted in our country when it was introduced forcefully.
Sure. When I look at everything that's available out there, so, possibilities of emergency contraception, post intercourse, when you look at the idea of there are drugs for a medical abortion, the ability for people to figure out if they're pregnant or not just with an easy test, and then obviously the final way of actually dealing with it through a medical, physical abortion. All of that information exists. It's about making sure that you utilize that information properly when you need to utilize it. Also in terms of protecting yourself from, diseases when you interact with a man, and knowing you both are safe. I think it's all interconnected. And as long as we educate our children properly, as long as we educate our population properly, I think that's the way forward. It is what's important. male contraception should be an equal part of what needs to be done long term. It shouldn't just be the woman's responsibility, and that also is part of our education system, where we make the man and the woman speak with each other. There is consultation and there is collaboration in deciding how and when our bodies are going to interact and how they should and what they should be done. Thank you, Dr. Shariar. Thank you, Dr. Gupta. Thank you, Dr. Tandon, for joining me for the show. I appreciate you discussing a topic which needs to be discussed. It matters. Our show is all about discussing what people stay away from. Thanks for watching. Good night and good luck.